You've developed a sort of 5-part system to help men manage premature ejaculation. Can you walk us through it? Absolutely. The first part is all about breathing. It's using your breath intentionally to stay connected to your body and tune in to your internal sensations. Breathing is the foundation of this whole process. It's not something you finish learning. It's something you keep returning to again and again. I typically suggest slow, deep breaths through the mouth, inhaling for about 5 to 7 seconds and exhaling for 5 to 7 seconds. This kind of breathing helps ground you and makes you more aware of what you're feeling physically. And this is in the context of sexual arousal. Yes, specifically during arousal. And when learning this technique, I strongly suggest beginning with solo practice masturbation rather than with a partner. That way, there's no external pressure, and you can focus purely on what's happening in your own body. Once the coordination improves, you can integrate it into partnered intimacy. The second part is something I call the anal breath. Essentially, it's bringing conscious breath and awareness into the back portion of the pelvis. In simple terms, the area around the anus. If you imagine the subtle muscular effort involved when you gently bear down, as if having a bowel movement, just a very light outward pressure, you apply that sensation on the inhale. Then, on the exhale, everything softens and relaxes. You don't add any extra tension. So, just to clarify, inhale while gently expanding that area outward, exhale and let go. Exactly. What this does is help bring you down from escalating arousal. During ejaculation, the pelvic floor contracts rhythmically, but many men who ejaculate too early are already holding chronic tension there, even before they reach that point. This breathing helps retrain the body to release that unnecessary tightness rather than unconsciously clenching. Learning to relax. That part of the body is a key step in shifting how we experience arousal, which brings us to step 3, separating your arousal curve from your anxiety curve, and learning how to stay grounded in arousal without being overtaken by stress. And honestly, this can be extremely challenging. There are different kinds of premature ejaculation. Some people develop it later in life, acquired, and within that group it can be consistent or it can come and go. Others have dealt with it from the very beginning, lifelong. For those who develop it later, the change itself often creates a lot of anxiety, and those who've had it lifelong may sometimes learn to accept it, but many still carry years of tension and worry related to it. What I've noticed again and again with clients is that as their sexual excitement builds, their anxiety rises in parallel, as if arousal and anxiety are fused together. Imagine arousal as a scale from 1 to 10 to 1 is mild interest. 9 is just before the point of no return, and 10 is climax. Now imagine anxiety following that same scale. Once you pass around a 5 in both curves, the nervous system flips from relaxation into fight or flight mode. At that point, it's very hard to feel ease, sensation, or pleasure. The body panics, and ejaculation often follows immediately. And for many men dealing with this, the climax itself doesn't even feel good. There's often shame, frustration, and a sense of failing. Sometimes that emotional burden becomes so heavy that men start avoiding intimacy altogether because the stress and embarrassment feel overwhelming. Now, going back to step 3, when you learn to separate your anxiety response from your arousal and use breath and relaxation, including relaxing the anus, you gain the ability to travel up and down the arousal curve more smoothly. That leads directly into step 4, which is surfing the sweet spot. This means being able to move within your arousal range while staying calm instead of jumping straight from arousal to the unstoppable edge of orgasm. And this connects back to step 2, the anal breath. So if you notice you're climbing quickly toward orgasm, you shift out of normal breathing and into that specific breath, and it brings you back down the arousal curve, giving you space, control, and awareness again. When I talk to clients about real mastery, I describe it like this. You're able to stay engaged in whatever sexual activity is happening, penetration, oral, manual, and simply by changing your breathing, you can lower your arousal by about 2 levels in just a few breaths. That level of control is like elite level body awareness. But in the beginning, most men have never come down the arousal curve before. They've only ever gone upward until orgasm. So the idea of consciously lowering arousal is completely new and often scary. Many worry that if they drop even a little, they'll crash all the way down and won't be able to get hard again. Learning to trust the body, trust pleasure, and use that specific anal-focused Breathing to step back down the curve is a major part of the process. I also imagine how tough it must be if someone is used to going from 1 to 10 almost instantly. Finding the mid-zone, like the level 5 range, can feel impossible. So, how do they actually build that awareness if climax happens in under a minute? In the heat of the moment, when everything feels intense and urgent, how do they gain that control? That's why practice usually starts with solo stimulation. It's about building regulation and awareness slowly. And honestly, step 3 is a massive challenge for many people, a real mountain to climb. In my program, I tell people not to continue to the next part until they can honestly check off the abilities in the progress list at the end of each section. Some men with very rapid ejaculation may need months, even 6 to 12 months, before they can truly separate arousal from anxiety and be in a sexually excited state while staying relaxed. It really depends on their personal history, their relationship with sex, and how patient they allow themselves to be. I've also noticed that people who experience premature ejaculation often have driven, fast-moving personalities. They're achievers, doers, problem solvers. That fast, urgent energy runs through their whole nervous system. So learning this new slowdown skill can feel extremely challenging. There was even research, I believe from China, that found men with premature ejaculation tended to be lower on risk-taking traits. It's interesting, because it suggests their overall temperament influences how their body responds in sexual situations. They also tended to be more anxious overall, which suggests that certain personality patterns might play a role. Whether anxiety leads to faster ejaculation or faster ejaculation creates anxiety is hard to say, but being more tense, more self-critical, and more performance-focused definitely feeds into the cycle. I tell my clients this all the time: we can examine how things developed, and that's useful, but we also have to deal with the reality of now, because it becomes a feedback loop. Anxiety leads to rapid ejaculation. Rapid ejaculation leads to more anxiety, and so it keeps reinforcing itself again and again. Let me jump back for a second, because step 5 is often forgotten, even though it's incredibly important. It's about letting the sexual energy travel beyond just the penis, spreading it through the whole body. The idea is not to hyperfocus on the genitals alone, but to let pleasure be a full-body experience. This shifts the mindset from "how hard am I?" or "how long can I last?" to "how much pleasure am I experiencing?" When men start seeing this work not just as lasting longer for a partner or preventing embarrassment, but as genuinely claiming their own pleasure and being able to relax into it, the whole emotional framework around sex changes. Now, to revisit step 3, because it truly is one of the hardest steps. What practical tools do I give people to actually understand their arousal curve and anxiety curve and get tuned in to their internal state? A big one is mindfulness. If someone has never meditated, never done breath awareness, or never practiced a body scan, we begin there. We work on noticing sensations. If you close your eyes, can you feel your index finger? Can you feel the big toe on your left foot? That ability to observe internal sensations is what eventually allows someone to notice rising tension, notice rising arousal, notice fear, and regulate it. And that's where breathing becomes crucial. It's a doorway into actually inhabiting the body. Rather than just being caught in anxious thoughts, feeling the body is what allows someone to stay connected to pleasure, instead of being overwhelmed by panic and urgency. So conceptually, what I'm picturing is that first you get familiar with the baseline sensations of arousal, what your body feels like when you're turned on. Maybe your attention narrows, your awareness of touch sharpens, you feel the erection and that surge of blood flow. Then, separately, you learn to distinguish the signs of anxiety. Maybe your shoulders tighten, you feel restless or jittery, a little on edge. Recognizing those as two different internal experiences is key. Step 1 is learning to truly relax. Then you introduce arousal and observe how your body responds, especially noticing where tension creeps in. Because, like we mentioned earlier, many men unintentionally clench or tighten to get or stay hard. They tense the pelvic floor, tighten the abdomen, even hold their breath. And that pushing or forcing can make everything worse, both in terms of erection quality and premature ejaculation. So the work becomes, how do you stay soft in the body? How do you breathe into sensation, really feel what's happening, and then objectively notice what's going on? And what's fascinating is that everyone's arousal pattern is unique. If I were in the room watching someone, I might think they're at a certain point on the arousal scale, but internally they might be somewhere entirely different. Part of the process is each man learning to map his own internal experience, figuring out for himself what each stage feels like. In a way, that's part of the joy of the journey, building a closer relationship with your body and discovering new dimensions of pleasure. Another tricky part is that the brain often mixes up different kinds of arousal. The physical feelings of anxiety, a pounding heart, faster breathing, maybe elevated blood pressure, are also signs of sexual arousal. So part of the work is realizing you can be sexually aroused and physiologically calm at the same time. You can be excited without being frantic. And for many men with rapid ejaculation, it feels like arousal automatically triggers panic. Like as soon as they start getting turned on, their nervous system leaps into emergency mode. That's something I frequently work through with my clients. It often feels like a kind of internal alarm, a sense that something bad is about to happen. For some men, that anxiety might be tied to past experiences, maybe being shamed for touching themselves as a kid, being caught and scolded, being mocked by a partner, or any experience that planted the idea that sexual pleasure could lead to embarrassment or trouble. Those old emotional imprints can show up later in life as panic during arousal. The key is learning to pull those emotional reactions apart, separating sexual excitement from fear or threat. Now, circling back to step 5, I know that for a lot of men it can sound a little mystical or abstract, so let's break it down in a very practical way. Many people joke that it sounds woo-woo, and I get why, but there's actually a grounded logic behind it. Think of the genitals as the main hub of sexual sensation. Yes, pleasure can live anywhere in the body, but the intensity is concentrated there now. Imagine that sensation like a drop of color falling into water. You watch it spread and swirl outward. That's the concept. The next time you're feeling arousal building, instead of letting all the energy stay trapped in one small area, you mentally let it spread, almost like directing that sensation outward through your whole body, down your legs, into your feet, up your torso, through your arms, into your fingertips. It's basically using your attention and imagination to invite the rest of your body into the experience, shifting from all the pressure is in one tiny spot to my whole body gets to feel pleasure. It's about recognizing that this can be a whole body experience, not just a genital one. When people reach a full body orgasm, you can literally see their entire body respond, pulsing and moving with the sensation. Women tend to discover this more easily on their own, but many men need guidance because for them the orgasm often ends up being just the release of ejaculation without that deeper, full body wave of pleasure. And I think part of the reason for that starts early. Boys are usually taught, directly or indirectly, that orgasm equals ejaculation, and that reaching climax quickly is the goal. So they grow up chasing the finish line rather than savoring the build-up or enjoying the sensation itself. On top of that, there's the performance expectation, especially in heterosexual contexts. Men often believe they must get hard quickly, ideally before their partner even touches them. That's a huge amount of pressure. And as men get older, arousal changes. Their bodies may need direct stimulation or time to build desire. So expecting yourself to be instantly erect sets you up for anxiety and frustration. Then there's the idea that you must stay hard long enough, but not too long, because now you risk drifting into delayed ejaculation, which can create a whole different dynamic. So many men end up in this paradox, where their own pleasure gets sidelined. They're not just present in the moment, they're mentally managing a checklist of performance criteria. Get hard, fast, stay hard. Don't finish too soon, don't finish too late. That's a lot to carry emotionally and physically.